what could be better than being available almost all the time?
When it comes to the ABCs of contemporary communication, the world speaks through emails, iPods, and PCs. The same tools that help us stay in touch with each other can help our doctors stay on top of our treatment even when they are not with us. Webcams that take you to the doctor?
Good morning, Dr. Herendine.
A robot that makes rounds?
It is kind of cute.
And devices that keep an electronic finger on your pulse. It's all possible in the world of digital doctor. It's a challenge working parents often encounter. When they get that call from school or daycare that their child is sick.
God, Mom told me that you weren't feeling good.
She had come down with a really bad fever.
Erica Haynes' daughter Ambrosia attends a daycare that uses a telemedicine program.
This is really our way of trying to bring that old-fashioned house call to the daycare center.
A mini clinic is set up at the daycare facility.
Under your tongue and close your mouth.
Specially designed scopes and monitors allow a pediatrician at another location to examine the child virtually.
This is just going inside of your ear.
We'll look in the eyes, we'll look in the ears. We have attachments on the computer that actually gives you detailed pictures looking into the back of the ears, looking into the throat.
The doctor can diagnose the child, order prescriptions, and in some cases, even have it sent right to the daycare center.
I know that if anything happens to my children, that they're going to be seen, they'll be taken care of.
How's the patient doing, Marcia?
Patient's doing excellent.
Robotic technology is helping doctors be in two places at the same time.
Before I go to bed at night from home, I can check in with my robot. I can light up the robot, drive to the bedside, answer any unanswered questions.
Using a joystick that can be operated from an office or home, doctors can drive the robot on the hospital floor to read a patient's monitor.
You get the whole heart rate.
Or pay a bedside visit.
Hello, Mrs. Johnson. How are you feeling?
I'm feeling great, thank you. No pain.
Built-in cameras and microphones allow the doctor to see and hear the patient, and vice versa.
Just about every time I visit a patient, some issue is identified that we can take care of.
While robots don't have exactly the same bedside manner, patients like having contact with their own doctor, even if it's virtual. A cyberspace connection could mean better heart health for millions who have implanted cardiac devices, like an ICD or internal cardioverter defibrillator. Using a sensor, patients take readings from a tiny computer built into the implant, then send it from a phone anywhere to an internet site their doctors can access.
He can directly download and transmit data from his defibrillator over a phone line to an internet service.
From a healthcare provider standpoint, the new system allows doctors to monitor a group of patients using just one device. It also allows for immediate update of a patient's electronic medical records, so errors are less likely.
I feel safe because the wife and I like to travel. You know, I don't have to worry about being next to a hospital in case something does come up.
Anything happened since I last saw you?
High-tech implants like CRT or cardiac resynchronization therapy device can be synchronized as needed, what doctors call optimization.
Battery's good.
Last year, the FDA approved a new timing mechanism that can shorten tune-up time. It uses electro-optimization versus the older methods that require an echocardiogram or ultrasound of the heart.
That process could take anywhere from half an hour to an hour, and you still may have missed the perfect setting.
Electro-optimization more precisely measures rhythms on both sides of the heart. It can be done during regular office visits in about 90 seconds, a fraction of the time needed the old way.
They look at the time that it takes for the signal to travel from one chamber to another. It can suggest what's the best programming for that device would be for this patient at that moment in time.
This new technique can also be used to help patients who've not responded well to other cardiac synchronization therapies.
I got my own emergency ward built into my chest.